Here we will discuss common flu symptoms in kids, its complications and treatment. Kids may experience either runny or stuffy nose and watery eyes, which may accompany with high-grade fever of up to 104 degrees. Coughing can be very intense, causing breathlessness, sometimes having bouts of cough which could cause stridor or breaking cough. Signs of difficulty breathing, like grunting, fast breathing, or stomach sucking in under the ribs. Due to having sick feeling, one doesn't want to eat anything whole day long. It may cause chest congestion leading to bronchiolitis or pneumonia. It can cause extreme fatigue and feeling of tiredness. Bed rest and less activity will give body to recover fast with less complications. Nebulization will be helpful in intense coughing as advised by the physician. Syrups for fever like Brufen and Panadol will be helpful to keep body temperature normal. Offer plenty of liquids to prevent dehydration, especially if they have a fever or loss of appetite. A cool mist humidifier can help relieve coughs and stuffy or runny noses. Sit with your child in a steamy bathroom to help loosen mucus. Saline nasal drops can help with congestion. For children older than 12 months, 1 to 2 teaspoons of honey before bed may help with a persistent cough. Antiviral or antibay medication may be prescribed for more severe cases, but it is most effective when started within the first 48 hours of symptoms.